If you've ever had a baby or been around a new baby, you probably have seen in a few days after birth, the baby's skin starts to look a little yellow and their eyes start having a slight tinge of yellow. The doctor or the nurses could say, don't worry, it's a normal jaundice. But then sometimes when another baby comes in, the doctors are running around with phototherapy lights and everyone is alarmed. What is the difference? Welcome back to Health Matters with Dr. May. If you missed the first part of this series, go watch the first part. The link is in the description. We covered what jaundice is, what is responsible for the yellow coloration in jaundice. Today we'll be talking about jaundice across all age groups. The truth is, jaundice in a 3-year-old baby is completely different from jaundice in a 60-year-old man. The causes are different, the warning signs are different, the urgency is even different. So let's walk through each life stage together. Let's start from the very beginning, the neonate, the 0 to 28-day-old child. If you've ever had a baby or been around a new baby, you probably have seen in a few days after birth, the baby's skin starts to look a little yellow and their eyes start having a slight tinge of yellow. The doctor or the nurses could say, don't worry, it's a normal jaundice. But then sometimes when another baby comes in, the doctors are running around with phototherapy lights and everyone is alarmed. What is the difference? The newborn jaundice is actually very common. It happens in more than half of all babies. After birth, the baby's body breaks down a lot of old blood cells very quickly, and the liver, which is still very new and still learning to keep up with all the stress that it's supposed to go through, does not know how to build up and break down this bilirubin pigment. So the bilirubin builds up and then the baby turns yellow. Now this usually occurs around day 2 or day 3, and then it clears out on its own within a week. This is the normal kind. This is called the physiological type. Most babies go through this, but there's a dangerous type. There's the one we call the pathologic type. This is the one that you should take very seriously. Now in pathologic jaundice, it occurs within the first 24 hours of life. So within the first 24 hours after birth, the baby is seen to start having this yellow tinge. The bilirubin level increases very rapidly and it could even persist beyond 2 weeks. Now it is usually caused by what we call blood group incompatibility. This happens when the mother's blood type and the baby's blood type are not compatible, and it could also happen with different range of other causes like congenital infection, maybe from herpes, from syphilis and the rest. Now the danger with having high bilirubin in newborns is in a condition we call kernicterus. This is when there is deposit of bilirubin in the brain, and this could cause brain damage, this could cause deafness, this could also cause cerebral palsy. Jaundice in newborns should never be dismissed without proper assessment. There are some major signs to look out for in jaundice in this age group. First thing is jaundice in the first 24 hours of life. This is a major thing. Please quickly run and see a doctor. When there is this yellowness that is spreading through the belly, the arms or the leg, this is an alarming warning sign. Now when the baby usually sleeps all the time or finds it difficult to even wake up for food, or the baby is not taking food, you should quickly visit an hospital. If this yellow tinge persists after 2 weeks of when it started, please visit an hospital. If the stool of the baby is pale, is white or clay colored, please quickly visit an hospital. Thank you so much for staying true to the end of this video. Please do not forget to like, comment and share this video with your friends and family. See you in our next video.